13 minutes before 9 o'clock. Heading down the home stretch here. Glenn Beck on deck. Happy Veterans Day. The parade steps off at about an hour and a half at 10:30 this morning. Great day for a parade. Alan Harvey, our good friend, is a Marine who is the veteran who is going to be the parade marshal. And a lot of veterans suffering from something we call PTSD. And it isn't pretty in many cases. There's a survey that says most wounded vets do struggle with PTSD, but Dr. Al Johnson is doing something about it. Dr. Johnson, what is the best and the worst, or the extremes of PTSD from the least form of it to the worst?
Well, I mean, it can be mild and can be severe. Mm-hmm. The whole problem is quite severe.
Yes, sir.
And that the recent study from the Wounded Veterans Association shows that 3/4 of those that were in combat over the past 15 years either suffered from PTSD or from traumatic brain injury. And that adds up to about 720,000 vets. So that's a significant situation.
Dr. Johnson, what are we doing to combat this? It looks like to me that we're paying more credence to illegal aliens and thugs than we are the people who are out there actually offering to take a bullet for us or who have taken one.
Yeah, and that's a problem. We really need to get focused on how to help these. The Veterans Association is overloaded. There was just a recent article in the Wall Street Journal on Saturday regarding Mr. Arnold Fisher out of New York, who's donated $65 million and created a center to treat vets with post-traumatic stress. And that center can only treat about 250 vets a year, which is just a very small part of what we're dealing with. So there's lots to learn yet. And they need treatment. They need focused treatment. And one of the things I'm participating in is a hyperbaric study of traumatic brain injury, where the vets are treated with 80 hours of hyperbaric, and the pilot study shows that about 80% are able to get back to some functional use after 80 hours of hyperbaric.
I've heard that's really effective.
Yeah.
Yeah, it is. And, of course, the football players are using it. Joe Namath has used it. And there's people that say it really doesn't work, but it's not 100% by any means, but it does work. It provides 10 to 15 times the oxygen to the brain cells, and it rehabs those brain cells that have been injured. And if you're trying to do recovery work, you've got to have the brain that works first before you can get much other recovery done or be cost-effective in that recovery.
Yeah, Dr. Al Johnson doing great work on PTSD. Coming up, a salute to our armed forces as we wrap it up next.